Assalamualaikum and welcome to my daily vlog. This is edition 300 and it's nearly a year now since I've been on this work here in Pakistan, and obviously I've not been doing it during my annual leave, but I've got today 300 through the work that we're doing, and I thought it will be a good idea today to just explain the nature of the work, because I keep getting asked and so just basically just setting the context of what I've been doing here, what my team has been doing here, and what our objectives are. So I'll briefly go through that and try to explain it in simple terms. So overall, we're working to what's called the Global Health and Security Agenda, which is something that the WHO and the United Nations has asked all member countries to try and do. So the work that we do directly contributes to ensuring a better health system and structure internationally. So that's the Global Health Security Agenda. And specifically the work that I'm doing here in Pakistan is to help the country Pakistan be better able to detect and respond to outbreaks and public health emergencies. So at the moment there's a big dengue outbreak, national outbreak, and even today, this morning, Saturday morning, I was over at the Emergency Operations Centre just helping and supporting the work there. So we activated that about a week ago. So the main, there's a whole vast array of things that need to be done here in Pakistan in the public health terms, but our mission is quite focused and well defined, and our specific outcomes that the Department of Health and previously before that Department for International Development wanted us to focus on was to strengthen the coordination arrangements within the health protection system, to enhance or expand the health protection technical systems in country, and also linked to both of those things is to strengthen the health protection workforce so that it is better able to address the public health threats. The aspects of that work essentially are around embedding what we call the IDSR, Integrated Disease Surveillance and Response System, that we've been running for a couple of years in KP, to embed that more formally, and then to get the structures right at the federal and national level in the National Institute of Health, and then through those systems, through the NIH, roll that IDSR system out to all the provinces, and then stepwise build that up so it covers the whole country, all health facilities, sending us daily or weekly data around the health and illnesses that are happening at the front line. And then further, just to see what other technical PHE support can be provided that can support this activity. So there's three main avenues of work. One is around enhancing what's called the multi-sector coordination, one is around data flow and information, and one is around the public health workforce. So going on to the multi-sector coordination, it's around developing and testing a multi-sector outbreak plan in one of the provinces in KP. So writing it, making the linkages, testing it, rolling it out, and then seeing how multi-sector interaction works beyond the health system. So that's a new concept. So again, it's codifying that and then learning from that and then rolling that out. Linked to that coordination piece, there's stuff around governance arrangements that the federal agencies and the National Institute of Health have between, following devolution, the federal level, NIH, and the provincial level, and how does the integrated surveillance system, the health surveillance system, work best in that system, where we can ensure that people know their roles and responsibilities. And then is developing the public health laboratory system and then linking those systems, so supporting the development of public health laboratories, which there are none in Pakistan, and we're sort of KP is further ahead than the other provinces. Identifying which microbiological tests are most appropriate for surveillance and response here in Pakistan. Establishing a working network of these laboratories, helping the different provinces develop a laboratory network, and then workforce development of public health staff within the laboratory. The third aspect is the public health workforce, I just mentioned there, but also around training or master training, what we call of people who can deliver training face to face around IDSR. What is IDSR? And the work that we're doing, both face to face and online training. We've also been involved in mentoring senior public health people in terms of public health skills and leadership. And then we're also trying to make links with the military around military secondment, so that then some of the learning can go back into that network. Also part of this workforce is developing a One Her Majesty's Government, One HMG partnership approach to interfacing with the Pakistani health community, and also using our experience around transformational change of organisations to speak to people like the Ministry or the National Institute of Health or the Health Services Academy on how they can restructure their organisation to make it more effective and flexible. And then there's an element that I'm dealing with, which is the data flow. So making sure the information goes from the front line to the centre, it's analysed, and the information gets back out. So objectives that we have is around developing a situational analysis around data and information systems, scaling up what data is already flowing from certainly one of the provinces, KP, and some health facilities in ICT, and the other provinces, getting them to send weekly data from districts and the basic health facilities within the districts to the centre. Then we analyse it there, write a report, send it back out. We've already established what's called the DHIS2 system, which is freeware software from the University of Oslo, which is a district health and information system, where version 2, where all the information is collated online. And then there's work around information security, data governance, setting up groups, developing SOPs, and then also piloting what we call case-based surveillance, so information about individual patients, so we can pinpoint more accurately where the outbreaks are, as opposed to just seeing the trends and early warning systems. And then using all of this, what we just talked about, 1, 2, and 3, to have a holistic approach to the IDSR and surveillance and response activities, which includes getting the data, getting the surveillance reports, getting the FETP fellows out, getting the provincial responses there, and getting the federal people involved in that in a coordinated national way. Also, what's been critical in the dengue this week is surveillance outputs for action. And then also trying to link our DHIS2 system with other surveillance systems like TB or other vertical programs. So in a nutshell, that's what we've been doing here. I've been doing here for a year, and certainly my colleagues for longer than that. And what do we get back in the UK? Well, it's an increased global health security, makes the world safer. It's linking with the Pakistani diaspora. So there's as we all know, there's huge links between Pakistan and the Pakistani diaspora, and not just the elite, just the common population as well. So helping picking up diseases and preventing them here will directly impact on the health in the UK. And also it's about building ties and relationships between the UK and Pakistan and fostering those things. So finally, in the year or so that I've been here, just a couple of weeks shy of a year, have I enjoyed it? Absolutely. I've learned a lot. The people are fantastic. And in the sort of 6 months or so that I've got left, and they're asking for an extension, but we're not there yet. There's still a lot to do, and I'm really looking forward to sort of making sure actually we step up a gear and start to do more of this stuff and roll it out more and demonstrate our value and demonstrate to the politicians and to the professionals the value of the good quality surveillance and response systems. And so certainly it's an exciting time. So anyway, that's day 300. Hope you've learned something, inshallah, and catch up soon, and take care. Remember me in your du'as, please. Assalamu alaikum.